Welcome to your open enrollment for TSG Solutions. Open enrollment is from August 14th through August 22nd. My name is Mireya Salcido and I will be your host. Open enrollment is that time you have to make changes, whether you're adding dependents, dropping dependents, or making a new plan selection. Open enrollment is that time to do so. All of you will have to go in Benetrack to make all of your elections. Elections must be made no later than August 22nd. Any changes you make will become effective September 1st. Full-time employees working at least 30 hours a week are eligible for benefits. Your eligible dependents will be your spouse, your state registered and unregistered domestic partner, and now because of healthcare reform, your children can remain on your plans till the age of 26, regardless of student status or marital status. Now, once open enrollment has closed, you really don't have another opportunity to make changes unless you have a qualifying status change. So, if you get married during the year, or perhaps a divorce, birth or adoption of a child, loss or gain of benefits, these would be some examples of a qualifying status change. Any qualifying status change must be made to Human Resources within a 30-day window. Let's talk about what's new. Your vision plan is now moving to the VSP network. Your healthcare flexible spending account and limited purpose flexible spending account, there will now be a rollover. This will no longer be a use it or lose it plan. There will also be an elimination of 2.5-month grace period. We will be reviewing your 2 medical options. There are no changes to your medical options, so we will be providing a brief overview of your medical options. Just as a reminder, your Open Access Plus, you do have freedom of choice, no referrals required. You obtain a higher level of benefit by receiving your services from participating or in-network doctors, specialists, or facilities. For certain medical expenses, you may be required to pay out of pocket and meet the deductible before your insurance company will cover the expenses. Once the deductible has been met, you and your insurance company will each share a percentage of the cost of care. So let's take a look at your open access plan. Again, as I mentioned, there are no changes. So you do have an individual deductible of $500 for the individual. This deductible will only apply to certain services. For example, your x-rays, your basic labs, inpatient hospitalization, outpatient surgery, those will apply for your deductible. Other than that, all of your other services are going to be based off of copays. For example, your office visit copay will be a $20 copay. Your urgent care will be a $25 copay, and you do have a $150 copay plus 10% coinsurance for your emergency room. Just as a reminder, if you ever need to seek services after hours, I would recommend going to urgent care. You are going to spend less time and money in the urgent care facility versus emergency room. Emergency room should only be for those life-threatening emergencies. Also, our preventive services are at no charge. So our yearly physicals, mammograms, pap smears, colonoscopies, all of that fun stuff considered preventive are at no charge. We do not have a deductible nor a copay for these services. The other thing I would like to remind you of is you do have chiropractic benefits. You have a $20 copay for 20 visits per calendar year. If any of you are taking medication on a daily basis, I really encourage the mail order program. You get a 90-day supply depending on the brand of the medication, if you are taking a generic medication, you would pay a $20 copay for a 90-day supply. So you could see how you really can get these great savings. Again, under the open access plan, you do have the flexibility of choice going in network, going out of network. As you can see, if you are going out of the network, you are going to be paying much higher deductibles and out-of-pocket expenses for out of network. So I really encourage you, anytime you are staying in the network or you are seeking services, stay in the network to get those in-network discounts. Healthcare reform. I'm sure we've heard plenty about healthcare reform, so I'm going to keep it very simple. Effective January 1st, we are all required by law to obtain medical coverage to avoid penalties at the end of the year, which will be 1% of your annual income or $95, whichever is greater. In 2016, that penalty goes up to 2.5% or $695. So as you could see, year after year, these penalties will increase. If any of you are still having questions in regards to what the best options for you and your family are in terms of medical coverage, or you have a child over the age of 26, or you just know friends and family that aren't being offered medical coverage, the insurance advocates at Barney & Barney specialize with individual policies and healthcare reform, so definitely do not hesitate to give us a call if you have any of those questions. The other option you have in terms of medical plan is a high deductible health plan. This is considered to be a consumer-driven health plan. A consumer-driven health plan combines a high deductible health plan with a health savings account. Consumer-driven health plans are intended to improve the consumer's healthcare choices, offer consumers incentives to exercise greater control over healthcare purchases, and help consumers become educated when it's time to spend money on healthcare services. The differences between a traditional PPO plan and a high deductible health plan is that all services under a high deductible health plan are subject to a deductible. Also, with a high deductible health plan, you have that option to open up a health savings account, whereas a traditional PPO plan you do not have that option. Some of the key features of a health savings account is setting aside your contributions on a pre-tax basis. Also, your balances roll over from year to year, and this is really your account. You manage it, you own it. You decide how much you want to contribute. You can change those contributions at any time you would like, and as I mentioned, those earnings grow at a tax-free for federal purposes and state tax purposes, except in this beautiful state of California. The contribution limits on your health savings account for 2014 for the employee only is $3,300. In the year 2015, that amount increases up to $3,350. For employee plus dependents for the year 2014, the max is $6,550, and for 2015, that also increases to $6,650. TS Solutions does contribute $500 biannually for employee only and $1,000 biannual for employee plus dependents. Let's go over some of these health savings account eligibility rules. For the employee to be eligible to open up a health savings account, you must be enrolled in a qualified high deductible health plan. You cannot be enrolled in a non-high deductible health plan, including a spouse's plan, Medicare, TRICARE, or a prescription drug only plan. You also cannot be claimed as a dependent on another individual's tax return other than your spouse's. You also cannot receive any health benefits from the VA or one of their facilities, including prescription drugs, in the last 3 months. You also may not be enrolled in a general purpose flexible spending account. So again, here are some examples of those expenses you can use for your health savings account. So again, these are going to be for your medical, dental, and vision unreimbursed qualified expenses. TSG Solutions has selected Health Equity as the preferred bank to handle your health savings account. Let's review your high deductible health plan with health savings account. Again, I can go in network, I could go out of the network. However, keeping in mind, if I am staying in the network, I am going to get those greater savings because of those in-network discounts. Under my high deductible health plan, all of my services are subject to my deductible. For the individual, I have a $2,000 deductible and I have a $4,000 family deductible. Under a high deductible health plan, if I am covering myself and even one additional eligible dependent, I am considered a family and must meet that family deductible. Once I have met my deductible, then my insurance will kick in at 80% and I will be responsible for 20% of the coinsurance. And I also want to remind you, your preventive services are covered at 100%. However, if I go out of the network, I am paying 20% for those preventive services. Let's review your tools, resources, and discount programs. Register online with Cigna to obtain all of your personal claim information, your personal benefit information. Perhaps you lost your ID card. You can go through the Cigna website and order a new ID card, check your claim status, and also refill your mail order prescriptions. Once you've registered online with Cigna, you can really navigate their system and take a look at the different discounts and programs available to you. For example, many of us may be working long and hard hours and a massage therapy might sound very attractive. You can go through the Cigna website and obtain a discount for massage therapy. Perhaps you're looking for a discount for fitness club membership, or maybe you would just like some vitamins and supplements. Definitely encourage you to navigate that system and see what different discounts appeal to you and might come in really handy for those discounts. Once you've registered online, you can download the mobile app and you can access all of that information through your phone. Let's take a look at your dental options. You do have a dental PPO plan through Lincoln Dental. And again, with my PPO plan, I have the flexibility of choice. I do not have to choose a primary care dentist. I could go in network, I could go out of network, and again, we're always keeping in mind by staying in the network, we are going to get those greater savings. Under your dental PPO plan, you have a $25 individual deductible, which applies to your basic and major services. Your preventive services are covered at 100%, which would be your 2 basic cleanings, your oral examination, and your x-rays attached to your 2 basic cleanings a year. Please do not get fooled by the 100% coverage out of network. If you are going out of the network to have your preventive services, you may have an out-of-pocket expense. For example, let's say your preventive service was $150. Once that gets billed to the insurance and the insurance states, well, we only deem $100 of this to be covered at 100% per the usual and customary rate, then you would be responsible for that balance. So again, keeping in mind when we are staying in the network, our coverage will truly be 100% and we will not have an out-of-pocket expense for those preventive services. You have an annual maximum benefit of $1,500, which will apply to your basic and major services. You have orthodontia coverage for children and adult. This coverage is 50% up to $1,000 for the lifetime. So the $1,000 is a lifetime maximum benefit. As I mentioned earlier, you now have VSP as your vision provider. Your vision plan is a PPO plan as well. So again, I have the flexibility of going to any provider I would like. However, keeping in mind if I do go to providers within the VSP network, I am staying in the network and I will get better savings. If I go out of the network under my vision plan, I am paying for my services up front, submitting my claim form, and then waiting for a reimbursement depending on the service I received. If I stay in network, for my vision exam, I have a $10 copay. I have a $25 copay for my lenses, and I have a $130 frame allowance or $130 contact lens allowance. It's one or the other. If I elect contact lenses, I want to make sure that I am filling that complete allowance on that single visit so I don't lose on any of that benefit. As I mentioned earlier, you will now have a rollover under your flexible spending account. But before we go into those details, I just want to remind you that your flexible spending account plan year runs from September 1st, 2014 through August 31st, 2015. You have a run-out period or a final date to submit expenses for reimbursement that were incurred during your plan year through November 30th, 2015. There are two components to your flexible spending account. One is the healthcare. You have a maximum contribution of $1,000 for healthcare and a maximum contribution under your dependent care, which is $5,000. Your eligible expenses under your health care will be all of those unreimbursed out-of-pocket expenses for medical, dental, and vision. Your dependent care would be daycare centers, before after school programs for children up to the age of 13, summer day camps, and even if you are taking care of elderly parents that require adult daycare, you can use your dependent care flexible spending account for that as well. Once you have made your election on the contribution amount that you would like to make for the plan year, you really cannot make those changes unless you have a qualifying status change. As I mentioned, you will now have a rollover for your flexible spending account. Although the plan year runs from September 1st, 2014 through August 31st, 2015, you will have the opportunity to carry over up to $500 of any unused flexible spending account funds from September 1st, 2014 through August 31st, 2015. And this is to the September 1st, 2015 through August 31st, 2016, and get reimbursed for expenses incurred during that time. If you have not had the opportunity to incur expenses during the plan year, the carryover allows you additional time to incur expenses up to the allowed carryover amount. The plan will provide a run-out period from September 1st, 2015 through November 30th, 2015, allowing you to seek reimbursement for expenses 3 months after the plan year ends on August 31st, 2015. Here's a snapshot example of how those flexible spending account tax savings might look. For example, let's say I make $36,000 a year and set aside $2,000 in my flexible spending account. Those savings at the end of the year would be about $614. So this just giving you an example of how those tax savings really look. As I mentioned earlier, if you are enrolled in a high deductible health plan, then you may only participate in the flexible, limited purpose flexible spending account, which would be only for your dental and vision out-of-pocket expenses. There are no changes to your basic life policy. This is 100% paid by your employer and provides you a basic life benefit of 1 times your annual salary to a maximum of $300,000, and also provides the same for accidental death, 1 times your annual salary up to $300,000. Always remember to keep your beneficiaries up to date. That's the only thing that's needed by you under this plan, is make sure your beneficiary information is up to date. You may elect to get additional life coverage. For the employee, you can elect in increments of $10,000 up to the maximum of $500,000. For the spouse, increments of $5,000 up to $100,000. And for children, you may elect $5,000 or $10,000 for children 14 days old up to age 26. If you elect additional life coverage, these are the rates depending on your age, and per every $1,000, that's how you will calculate the amount of that additional coverage you elect. There are no changes to your short-term and long-term disability. For your short-term disability, there is a benefit of 60% of your monthly earnings to a maximum of $2,500 per week, and there is a 7-day elimination period. Should you need your long-term disability, this is a 60% of your monthly earnings to a maximum of $7,500 per month with a 180-day elimination period. The Employee Assistance Program is a wonderful program. This program is here for you, your dependents, and anybody living in the home with you. This program is paid 100% by your employer, and it's 100% confidential. If you're ever needing advice, whether it's you were a victim of identity theft and you don't know where to begin, maybe you're having some legal or financial issues, or you have 2 teenage daughters like I do, then you really need the Employee Assistance Program. You can call 24 hours a day, 7 days a week, or if the issue you're having requires some more personal time, you do have 4 face-to-face sessions per member, per issue, per year. And again, 100% confidential and extended to anybody living in the home with you. So if you have any wonderful family members living with you, the wonderful brother-in-law, cousin, brother, you can send them over to the EAP. Maybe they'll get some advice on how to get off of your couch and out of your home. Barney and Barney has a monthly well-being challenge. This is really here to help raise awareness and engagement by offering fun activities, exciting incentives, and an easy user-friendly method to participate in those monthly challenges. There are some fun topics, some just to include fitness, weight management, some stress management. Maybe there are some goals that you would like to set. Definitely take part in those monthly challenges, and you could possibly win some cool prizes, just to include an iPad, a $75 gift card, or a $100 charitable donation. This concludes your open enrollment. So just as a quick reminder, review your personal options, review your new payroll deductions. Your deadline to enroll via Benetrack will be no later than August 22nd. Thank you so much for your time.